Hello everyone, welcome to Nursing Tutors channel. My name is Bruce Kamsim and today we are going to discuss the pharmacology of aminoglycosides. The aminoglycosides end with a suffix mycin, mycin or sin. And these ones are part of the protein synthesis inhibitors. So however, if you meet a drug that ends with thromycin, it is not a aminoglycoside, it is a macrolide. So examples include streptomycin, gentamicin, tobramycin, amikacin, streptomycin, and other different drugs that have that suffix. So these drugs, of course, they are widely used, they are popularly known, and but in most cases they are not used in singular, they are not used alone, they are used with other classes of antibiotics. For example, you've seen it in pneumonia being used with ampicillin, you've seen it combined at least with another drug. There are no oral formulations of these aminoglycosides, but they are always available parentally and topically. They are highly effective on only gram-negatives which are aerobic, and especially those bacilli, e.g. Escherichia coli. Therefore, you can administer them in patients with urinary tract infection, in patients with Klebsiella, any special Klebsiella pneumoniae, we can work. Then Proteus, Pseudomonas, and Mycobacteria, specifically streptomycin and amikacin. These drugs are used for second-line treatment of tuberculosis. However, they are not always used in treatment of gram-positive aerobes. And if they are to be used for treatment of gram-positive aerobes, then they should be used at least with a beta-lactam. So aminoglycosides, we have seen they're effective on E. coli, etc., but they are also indicated in serious infections, for example, endocarditis, because of their bactericidal effect, in complicated infections, especially those ones of complicated UTI, complicated soft tissue infections, septicemia, osteomyelitis, pneumonia. They can be used in monotherapy treatment of taulemia and plague. So they are drugs of clinical importance and they are readily available in the field for treatment of the above mentioned conditions. And these aminoglycosides, among all the protein synthesis inhibitors, they are the only bactericide. Other protein synthesis inhibitors are bacteriostatic, hence benefiting from them. Then these drugs like streptomycin, they have gotten resistance. We have had issues with them, and the resistance is through alteration of the 30S subunit, through transferase enzymes, and etc. So the mechanism of action, we have said they are bactericidal and they bind irreversibly to the 30S ribosomal subunit, hence achieving bactericidal effect. They have a post-antibiotic effect, meaning that they can continue to suppress bacterial growth even when they fall under minimum inhibitory concentrations. So if a patient has been receiving gentamicin for a week, he may have those maybe microorganisms being inhibited for other more weeks. So from the diagram, you can see the 30S subunit and you can see the 50S subunit. So these ones inhibit this, the aminoglycosides inhibit the small subunit, which is the 30S. And hence the bacteria will not be able to synthesize these proteins. Let's look at some of the adverse effects or side effects. Of course, they are highly ototoxic. especially when used with other ototoxic agents like quinine and loop diuretics. So they affect the vestibular and the cochlear, leading to vertigo and the disequilibrium, tinnitus, and hearing loss. So these drugs should not be used for longer, should not be used in patients exposed to sound, should not be used to patients who already have uh, hearing impairment. Then they are highly nephrotoxic, they affect the kidneys, and remember they are always excreted in urine unchanged. So they should not be used with other drugs that are highly nephrotoxic. So they cause acute tubular necrosis in the kidneys in about 10 to 20% of the patients, and in most cases they are reversible. After withdrawing the drug, this kind of nephrotoxicity tends to go away, but it should also not be given more than 5 days to reduce the likelihood of these side effects. So they cause neuromuscular blockage, especially when given in high doses, and the most affected part is the respiratory tract. Then myasthenia gravis is absolute contraindication of aminoglycosides. Remember, in myasthenia gravis, we already have neuromuscular blockade. So you can reverse this with neostigmine and calcium gluconate. So majorly these are the commonest three side effects of these drugs. However, we have other side effects like hypersensitivity, which is very rare, and etc. So subscribe